Let's take a look at a clinical documentation example and how the information in the note supports appropriate ICD-10 code selection. In this example, the chief complaint is a 40-year-old male with diabetes and eye problems. HPI includes a long-term history of type 1 diabetes, good control with insulin pump, no renal, hepatic, or peripheral complications, lipids and triglyceride under control, and last hemoglobin A1C was 6.6. The patient had stable mild proliferative diabetic retinopathy with no visual acuity problems, which recently advanced to moderate non-proliferative with macular edema. Fundoscopic exam supports the diagnosis of moderate non-proliferative diabetic retinopathy due to the existence of microaneurysms, hemorrhages, and thickening. Also present on exam is macular edema, the leading cause of visual impairment in diabetics, although visual acuity is still 20/30 in this patient. In ICD-9, this clinical scenario would require 3 codes: 250.51 for type 1 diabetes with ophthalmic manifestation with good control, 362.05 for the moderate non-proliferative diabetic retinopathy, and a third ICD-9 code, 362.07 for diabetic macular edema. This same patient and clinical story would receive a single code with ICD-10, E10.331, type 1 diabetes, with moderate non-proliferative diabetic retinopathy with macular edema. The E10 component of the code, type 1 diabetes, comes from this component of the documentation. The remaining code regarding non-proliferative diabetic retinopathy with macular edema comes from this component of the note. It is extremely important to realize that the exam finds are clinically interpreted as being moderate non-proliferative, but coders will not make that interpretation unless it clearly specifies moderate non-proliferative as noted in the HPI. Let's review one more example.